Good evening, everyone. My name is Kirsten Pilati. I'm the very proud CEO of Breast Cancer Network Australia. Before we get started, I want to pay tribute and acknowledge the traditional owners of the land on which we meet tonight. I pay tribute to their elders past, present and to the future. How exciting to be here in what is Lymphedema month of March, and this is clearly a very big unmet need for us here in Australia. But I have heard on the grapevine that we do have someone listening in from France as well, so bonjour to you as well. So tonight is all about getting the information that you need around lymphedema, but also it's really important that you play a role in helping us feed in questions. So you can do that on the webpage. So I really want you to start asking questions as we hear from some of our specialists. Now, click please, Jen, because thank you. I've lost my clicker. But what I wanted to say was that this webcast has really come about because for 18 months we travelled around Australia and heard from you, our members, about what were some of the unmet needs. And sadly, when we began in 1998 with the Making a Difference report, we saw that there were unmet needs in lymphedema. Again, in 2005, lymphedema still had not progressed the way that we had hoped it would. And very sadly, in the 2017 State of the Nation report that we delivered to Canberra, lymphedema continues to be an unmet need. So tonight is all about information, as I said, but we want to hear from you. So please interact with us and give us your questions that you want answered from the specialists that we have here tonight. So let me introduce those to you first. We are very fortunate to have some of the best in the lymphedema area, and I want to welcome Jen Gilchrist, first of all, a breast oncology nurse at the Macquarie University Hospital, to Louise Kohlmeyer. See, I told you if I practiced beforehand it wouldn't work. So Louise Kohlmeyer, also from the Macquarie University, an absolute legend in lymphedema around the world. So we're really looking forward to hearing from you, Louise. And Marilyn Miller, who joins us as a cancer survivor and someone who is living with lymphedema. And it's so important for us to hear the voices of women like you, Marilyn, so thank you very much for coming. So we want to get straight into the content. I'm going to hand over to you, Jen, and please tell us a bit about what is lymphedema. I want to remind everyone online to keep sending in your questions, and as soon as they come in, then we will continue to discuss those. So, Jen.
Thank you, Kirsten. So thank you for having us here tonight. We're going to talk to you about understanding lymphedema following breast cancer. I'm going to start with a general overview and talk about what it actually is, talk about the risk factors and early warning signs and symptoms of it. Louise is then going to talk about risk minimisation, education, conservative treatment techniques, and managing the lymphedema maze. So what is lymphedema? As we know, it is still a common issue amongst survivors and people having breast cancer treatment. It's a survivorship issue following breast cancer, and it can be a daily reminder of having had breast cancer. It is scientifically the accumulation of excessive amounts of fluid resulting in swelling in one or more limbs, usually the arm or breast in this context. Lymphedema can result from damage to the lymphatic system due to surgical removal of lymph nodes, radiation therapy and or chemotherapy. There's also a diagram there that talks about the effects of breast cancer and lymphedema. And it's not just a physical effect, there's also functional effects and economical effects. These treatments cost a lot of money. And what is that last one, Louise, that I can't read there?
Physical, functional and psychological.
Psychological, yes. So it can have a large psychological impact on patients, particularly that are undergoing, and I think we'll hear from Marilyn later a little bit about that. So what are the risk factors associated with getting lymphedema? The most obvious one is surgery, and I think there is still a lot of panic about having lymph node surgery, and that's something that we sort of want to debunk a little bit later. But certainly the extent of the surgery and whether lymph node dissection is performed is definitely a risk factor. So if you've had an axillary lymph node dissection, so you've had, say, more than 3 or 4 lymph nodes removed, you're at a higher risk versus having a sentinel node biopsy, which is a newer technique that is done quite standardly now, where you usually only have one to three lymph nodes removed. So the risk is higher if you have more lymph nodes removed. If you have radiation therapy to the axilla, that also increases your risk. Trauma to the arm or limb, infection in the arm or limb, an increased body mass index also makes a difference. So if you are obese or you are chubbier, you have a higher risk of getting lymphedema. Immobility, so not using the arm, is actually not a good thing, and we're going to talk about that a little bit later. The other thing that is still sort of undergoing some research is the effect on taxanes, which is a common chemotherapy that patients receive for breast cancer treatment. And we know that, we suspect there's actually a 6 times risk of increased transient swelling. One of the side effects of taxanes is fluid retention, and many of you would have put on weight having your Taxol chemotherapy, and we know that that can increase the risk of lymphedema as well. But there's still research ongoing about that. It is really, really important to educate women according to the risk stratification. So if you fall into that high-risk category or low-risk category, most women these days fall into the low-risk category. And I think a lot of what we were told and what we are educated stems from myths from 20 years ago, and things have now changed. We've got scientific evidence to prove that a lot of these old wives' tales are not actually true at all. So, as I mentioned, the risk of developing lymphedema is higher in certain groups, and I've outlined there the extent of the surgery having an impact. So if you have a sentinel node biopsy, like I said, it's common standard treatment now, the risk of developing lymphedema is about 5 to 9%. If you have an axillary dissection, the risk of developing is 20%. Axillary radiation is about 14%. And if you have axillary radiation and surgery, the risk is about 30%. It often occurs within 6 months to 3 years post-surgery. So it doesn't very often happen straight away. It's not impossible, but usually it happens between 6 months to 3 years. Just going to discuss the early warning signs so that you all know what to look out for. In the beginning, it can be vague and intermittent, which means it can come and go. You might have some feelings of heaviness in your arm. You might have some aching, pain, or some tension in your arm as well. You might find that your arm is feeling quite tight or full, and your clothes might become tighter, and that's sometimes a sign that your arm is swelling, or your bracelet that used to, dangle quite loosely is now a lot tighter on your wrist. In the beginning, it's very transient, so it tends to come and go. And a classical sign and something that our lymphedema specialists check for is pitting edema, so soft indentations, and there's a picture there. What that basically means is that if you have a swollen limb, if you press your thumb into it and leave it there for 30 seconds and you remove it, when it's pitting, the dent stays there. If there's no dent, it's not pitting edema. Early detection and effective management can reduce symptom severity and improve quality of life. It is the key to success and gaining long-term control, and Louise is going to talk a little bit more about that later. So what are the signs of progressing lymphedema? So how do we know that it's actually getting worse? We know that the swelling persists in people that have got progressive lymphedema. It may extend, so in the beginning it may just be the lower portion of your arm, however it may extend to your fingers and your upper arm. Your arm becomes more sore and more uncomfortable. It becomes heavier. It becomes tight. You have difficulty moving your arm, mainly because it's heavy. The skin becomes thickened as well, and actually the pitting edema decreases, and what happens is that the fluid becomes fat, and that's why the skin is not as soft and the fluid, the swelling, is not as soft anymore. It is diagnosed by having a greater than 2 centimetre difference in circumference between your limbs. Over to Louise now.
Okay, so what I'm going to talk about is how to reduce your risk for developing lymphedema and what can you do in your daily life to really reduce the risk of lymphedema. The first thing that's really important is that I want you to use your arm normally for daily activities. So in the past, women were told to avoid doing activities or don't do heavy activities or repetitive activities. my advice to my patients is that I want you to use your arm normally. So whatever you did prior to breast cancer, you should be able to return to those activities. However, the second point is important, that you do need to become in tune with your body and be in tune with any signs or symptoms that your arm feels different to the other arm. So I often give the example that if you previously were going to the gym 5 times a week, doing a very vigorous exercise program and lifting heavy weights, and you've taken 6 months off going to the gym because of breast cancer treatment or going to those classes, you may find you have to gradually upgrade your level of activity to get back to where you were before. Likewise, if you played competition tennis 4 times a week, you might have to start by just having a general social hit first and then gradually play more tennis and get your arm used to it. So we want you to be able to do what you did before, but listening to your body is important. We really want you to try to maintain a healthy weight and participate in regular exercise. I'm sure we're going to talk about exercise a lot this evening, but we know that exercise is really important in reducing your risk of developing lymphedema. And for those of you who may have already developed some lymphedema symptoms, we know that exercise is important at helping you to manage the lymphedema. We know that when you're moving your arm, the muscles are helping to pump the lymph vessels to help move that fluid through. And that's something that in the past we were probably a little bit resistant or hesitant to tell people to do. But you can see there the photo of the women doing the dragon boat racing. That's really quite vigorous and heavy work, and there's been some research that showed that doing dragon boat racing or that type of exercise does not exacerbate or trigger lymphedema. So the key message from today to help reduce lymphedema is we need you to get into exercise. But it doesn't have to be everyone going to the gym, because I know some of us here even might not be gym people. But the key is to try to do something that's going to help you move. Even incidental exercise like parking your car further away from the shopping centre entrance to help your body do a little bit movement throughout your treatment, which will also help in reducing your risk for developing lymphedema. So choose something that you like. If your friend invites you to go and meet her for a coffee, then perhaps say, let's go for a 30-minute walk before we go and have the coffee. And then you're both getting the benefit of the nice talk, the nice coffee, but also helping your lymphatic system as well. So really encourage you to move. Skin care is really important in reducing your risk for lymphedema, because we know one of the main roles of the lymphatic system in our body is to fight infection. And so we're really keen to try to reduce infection in your arm or the quadrant that you've had your breast cancer surgery, so either the breast or the mastectomy scarred area. Whatever moisturising cream you like is absolutely fine. What I often suggest to women is that they put the moisturising cream next to their toothbrush or on their bedside table, so that it becomes a new behaviour that they start doing, a new routine to try to moisturise the skin. When the skin's well moisturised, then there's less tendency to perhaps bump it, knock it, open the skin area and potentially let any bugs or bacteria around to get underneath that skin and develop an infection, which we often call cellulitis. And often women who develop cellulitis, it can happen really quickly, and we need to get medical attention quickly. So if you look after your skin, keep it well moisturised. I recommend that when you're putting the moisturising cream on, that you put it on in an upward direction on the arm and direct it towards the axilla area and keep that skin really moist. I'd also suggest do it on the other arm as well, and the breast chest area, so that the whole body is looking really well moisturised. We've got there about meticulous skin and nail hygiene. That also is related to the infection risk that we talk about. So it's fine to go and get your nails professionally done, but please use a salon that's going to use clean, not reusable items when they're doing the nails. But certainly the key message is trying to reduce infection in getting nails. And, you know, loose skin and things, don't rip it off. Take care because of risks of infection. So there's again, we talk about exercising the affected arm, and we know from the recent literature that resistive training exercises are beneficial in helping the circulation and the lymphatic pumping, and do the exercise that you like doing most. Swimming, exercises in water, aqua aerobics are all good. Gym program, weight programs are all really good. But start with something you like doing rather than what someone tells you you should be doing. And the guidelines are to try to do 150 minutes of exercise in a week. And you can actually distribute that across the whole week, doing 5 30-minute sessions or, shorter sessions throughout the week. If you're still going through treatment, you might think the word exercise is just a bit overwhelming. So you need to do whatever you feel able to do, but trying to move your body is actually going to help you physically, but it's also going to help you psychologically as well. The last question that comes up there is what to do with travel and your risk for lymphedema when you go travelling on an aeroplane. And there are lots of myths about this. I guess our general guidelines are if you're in the higher risk category for lymphedema, so you've had more lymph nodes removed, more treatment to the lymph nodes, then we would recommend if you're travelling greater than 4 hours on an aeroplane to get properly fitted with a compression sleeve. A compression garment is graduated pressure. It's got more pressure in the lower part of the arm and less at the top. But you just don't run out to a chemist and get that without getting some education and some support in what to do when you're travelling. So the key things that I tell my patients are that if you're planning a trip, and many women plan an overseas trip to celebrate finishing breast cancer, which is fantastic. We don't know from the literature, though, whether it's actually the aeroplane that triggers the lymphedema. Because what I have observed in my practice is that women plan these trips, and it's a big thing to plan to go overseas. So they spend time in finishing up their work activities, maybe tidying the house so the robbers can come into a nice clean house while they're away. They then pack their 20-kilogram bag and suitcase that they're going to carry around on this new trip they're going on. And it's not until they get in the Greek islands for the last week of relaxation that they notice that there's swelling in their arm. And then when they return, they said, well, I got the swelling when I travelled. It must have been the aeroplane. Now, we don't know from the research that the plane actually triggers that. The theory behind it is that you've got reduced cabin pressure and you're at high altitudes, and that can sometimes retain fluid. I know I get swelling in my ankles when I travel long distances. So what we recommend is that the compression sleeve that needs to be properly fitted for you. So it's not something that can just go on at the last minute. It needs to be planned, get it appropriately fitted. I recommend that you wash the sleeve before you wear it, so get rid of that newness feeling. And also use the sleeve as a bit of a reminder that while you're on the plane, try to exercise once an hour when you're on the plane. Now, it is hard to move and exercise when you're on a plane, particularly if you're down in the cattle class at the back. So you might want to sit your partner next to you so that you can do your arm that way or out in front of you. But usually once an hour while you're awake, try to do some pumping of the lymphatic system through movement, and also use the sleeve as a reminder to keep hydrated. So if you want to celebrate and have that glass of champagne on the trip, make sure you have 2 glasses of water to keep yourself hydrated on the plane. And remove that sleeve when you get to your hotel or wherever you're staying when you reach your destination. So we just wanted to spend a minute or two on some of the myths that are out there. And I know that some of these things that are on that screen, we used to tell people 25 years ago. But we know from more research that's happened over the last few years that a lot of these things you may have read or heard are actually not true. So the first one there, nothing can be done for lymphedema. That is so not true. Our key message for you tonight is early detection and early management can hopefully prevent lymphedema, or if not prevent it totally, can reduce the significant consequences of this condition. So treating early, and there's very effective treatment and lots of treatment options for managing lymphedema. Another question out there is having a blood test or blood pressure taken on your arm at risk of your breast cancer surgery. Again, from a scientific point of view, there's no substantial research to support that. However, what we generally say in our clinical practice is that you've got 3 quadrants of your lymphatic system that have not had any trauma or surgery to them, and one that is potentially a little bit compromised after having lymph nodes removed. So if you're getting routine blood pressure or blood taken, it's probably worthwhile asking your doctor to have it done on the unaffected side. However, there's no research to say that if you have blood taken or blood pressure taken on your at-risk side, that that's going to cause you any problems. Another one there is, I've got lymphedema in my arm, I'm not allowed to use it anymore. Hopefully I've already dispelled that method because we want you to get back to all your normal activities. And we don't put weights on there or weight restrictions of what you can lift using your arm, because I can have 30-year-old women who are carrying a 10-kilogram baby all day, and I can have 70-year-old women carrying 10-kilogram babies as well, because they're minding grandchildren often these days. So if you were doing that before your breast cancer, we're going to be able to help you and support you to get back doing that. I've already talked about aeroplane flights triggering lymphedema. From a science, we say not true, but we would take those precautions that we've mentioned. Diuretic medications lessen lymphedema. That's not true. So sometimes women tell us that their GP has prescribed the diuretic medications to help their lymphedema, and generally there's no response from taking those in helping the lymphedema. So it's working on a different system, so it's not something that's evidence-based or that we would recommend. And the last thing there, I've told I shouldn't lift heavy weights, handbag or shopping bags. Again, not true. But all I would suggest is that you be sensible with your arms. And if you notice that you're carrying shopping bags, maybe instead of carrying 10 bags from the car boot into the kitchen, maybe you make 2 trips and you're getting a little bit of exercise while you're doing it as well.
So, Louise, we are getting a lot of questions through. I just want to ask a couple that I think could go potentially to this slide. One is from Sheila, and should those with lymphedema wear a medical alert bracelet on the affected arm?
That's a good question, and that's something that we've often been asked, and a lot of women used to do that in the past. Again, I would really urge you to be aware of whether your lymphedema risk is high risk or low risk. Possibly if you're in the higher risk, there's nothing to say, to not wear it. It would be okay. But I don't want women to get alarmed about lymphedema. We really need to dispel these myths that are on here. Yes, if you were in a car accident and taken to hospital, if you had blood pressure or a needle or a paramedic put a needle in that at-risk arm, then I think they're putting a needle in because potentially life-threatening events happening, and I wouldn't be worried about it. So, I don't advise my patients to wear the Medical Alert bands. There's been a lot of discussion in hospitals about whether they put it on or not. Generally, yes, that side's affected in that it's possibly got reduced capacity, but there's no real evidence to say, yes, everybody needs to do that, because then we create paranoia, and our medical doctors will say, reduce the paranoia, it's not evidence-based.
So I know you've got some more slides, but I do have one other question, and that is around actually shaving in the under the arm of someone who has had lymphedema, and Jess is asking us about that.
That's a good question, Jess, and I always get asked that question. So the issue with shaving under the arm is that if you're using a blade razor and you do a quick shave because you're racing out to wear a summer top, potentially because you've had lymph nodes removed, you've got reduced sensation, altered sensation under your armpit area. So you may not actually realise that doing your little quick shave has actually nicked the skin and caused it to bleed. Now, that opening in the skin could potentially lead to an infection, and that's what we're concerned about with the issue with shaving. So it's not that shaving's going to cause lymphedema, but the shaving with a blade razor potentially could lead to an infection, and that's what we're concerned about. So you can shave under your arm, but I'd put on your Mother's Day list an electric shaver, and we'd probably also say to avoid using waxing because of the hot wax potentially burning the skin, leading to infection. So there are hair removal creams as well that you can use that are very safe and effective. But the key message is just be aware of what you're doing, and if you understand the reasons behind it, then you're going to be more inclined to be careful.
So I want to say to those people who are live with us on tonight, one, it's great to have you all. Keep your questions coming through because we will get to answer those. So sorry for interrupting.
No, that's fine. We're almost at the end of these slides anyway. So this slide just talks about management of lymphedema, and I talk about my toolkit for managing lymphedema because as a lymphedema trained therapist, there's lots of ways we can manage lymphedema. The traditional way is called complex lymphedema therapy, or CLT, and I would advise that if you have symptoms of lymphedema that you go and see a qualified lymphedema therapist who can really work out a partnership with you to work out which treatment strategies are going to be most effective for you as an individual and your lifestyle, and which treatments are going to work best. And then the comment I wanted to have here was managing the lymphedema maze. How do you find a qualified lymphedema therapist? Do you seek management in the public or the private sector? Are there waiting times? Are there costs of treatment? How much do I get back? What options do I have? There's lots of question marks around here, and we don't have time necessarily to talk about all of them, except what I would advise is that I would recommend that you seek a qualified lymphedema practitioner. They are usually occupational therapists, physiotherapists or registered nurses, and also massage therapists are also trained in managing lymphedema. There is a register that the website's here on the Australasian Lymphology Association's website. And if you go to that website, you can actually put in where you live, your postcode or your suburb, and you will be able to find an appropriately trained therapist who can assess you and then work in partnership with you to help manage your condition. There's the Chronic Disease Management Program, which is a Medicare-based system that you would talk to your GP about in order to get a Medicare rebate for 5 visits to a qualified lymphedema therapist over a calendar year. So talk to your GP. These systems are available. They're not a lot of rebates, but they're better than nothing. And there are compression garment schemes. Unfortunately, there's probably not equality around the country when we talk about access for these garment schemes, but certainly talk to your lymphedema therapist to see what can you access to help in supporting the costs of lymphedema treatment.
Thank you, Louise. As always, very concise but some fantastic key messages for us to take out. But I think there is no doubt that exercise plays a critical role in the way that anyone who's had breast cancer can come back after treatment and during treatment, and that isn't just in relation to that around lymphedema. But I want to now throw to Marilyn. It's great to have you here. Can you tell us a short bit about your experience with lymphedema first?
Yes. I first met Louise before I had my breast cancer surgery, and she very kindly explained what lymphedema was. I had no idea what the lymphatic system was or did, so it was the start of a big learning curve. We had regular appointments after my treatment. I had a full axillary, and I had 31 lymph nodes removed, I believe. All clear, I'm glad to report. But over the following months, I had chemo and then radiation. So I was in the high-risk category. And it certainly has made a huge difference to when I was diagnosed early with lymphedema and the journey since. So this started back in 2012. I had my surgery. And it was 2013 when we first got the symptoms of lymphedema.
So what for you was that trigger around the symptoms? Because obviously you had Louise in your corner, but something must have happened to you to kind of think, should I be going back and spending more time with Louise?
Well, before I had my surgery, Louise took some measurements, both physical measurements and also a thing called an LDEX, as a baseline, and we were monitoring that very carefully over the subsequent months. And even before I realised, it wasn't a question of my arm was swelling up, that this showed up as was an underlying condition that was starting. So I was very fortunate that we were able to take some steps to prevent it from getting worse too quickly. I'm glad to say that over the last 7 years, I think that must be, we've had our highs and lows, and it's certainly much better now than it was 2 and 3 years ago, courtesy of the treatments. I do a lot of self-massage. I also have a professional massage therapist who I see usually every 4 to 6 weeks. I was using for some time a pump machine, and I'm sure Louise will remember what that's called, I'm not quite sure. And all these have helped. And, of course, as you said, losing weight helped. There's no question about that, which I did last year. So, yeah, there's a lot you can do yourself, but you do need to be proactive.
Absolutely. I think that's such an important message. And that losing weight, it's making that first step.
Yes.
And I think that something that really resonates with me when we're out in the community is talking about doing something more tomorrow than you did today. And just getting started is the biggest hurdle. And, you know, I think there's no question that it's so important for us to all get moving. Yeah. But it is always easier said than done. I want to ask Louise, you and I have had many a conversation about how we want to influence the system so that we can really make sure that we are looking after patients early on in lymphedema, and that is about taking those baselines that Marilyn talked about. What if this is a whole new thing to you? You were diagnosed with breast cancer 3 years ago, you've finished your treatment, and the baseline discussion around lymphedema never happened to you. What's your advice to those people?
It's my vision, Kirsten, that every woman diagnosed with breast cancer in Australia in the future will have access to baseline treatment measurements so that we can then monitor for lymphedema and detect the earliest signs and manage it. Because the research really shows us if we detect it early, we can manage it much more effectively. So I would really suggest that if you haven't had a baseline measurement, and many women haven't around the country,
most.
There's a lot more that have had it now than they did 10 years ago. But what I would be saying is if you've got any signs or symptoms that your arm doesn't feel quite right, then seek out a qualified lymphedema therapist who will do a holistic assessment for where you are now. So we may not have the baseline to go from, but we do have guidelines and good assessment skills to be able to help you assess what's going on now and how we might be able to help you reduce those symptoms.
I think the other key message is if you have just been diagnosed, make sure you ask for a baseline. But certainly our role as policy developers through BCNA is to make sure that the baseline happens to every person, and I can promise you, won't stop until that happens. So, Jen, a question's come through about can letrozole affect lymphedema?
My answer is no. What it can do, though, is that it can affect your metabolism. So, basically any of the hormonal agents can affect your metabolism, and that makes you fat, which is why a lot of people put on weight. And it's not the tablets that are making you put on weight, but it's changing metabolism, and therefore you can't eat the chocolate and, you know, have all the things that you liked before, you know, when your metabolism wasn't affected, when you were sort of effectively premenopausal. So, as we've mentioned already, that putting on weight increases your risk of lymphedema. So that's the link there. So the answer is no, but, you know, there is, I guess, a relationship of some sort.
I know, I think we're all over the BMI and the exercise already, aren't we? But the sad reality is we've got to not be over it. We've got to get on board. So another question's come through from Lynn, and I think this is one that really came through for us in State of the Nation and through our surveys, is this fear of lymphedema, and we've talked about this, and the risks, Jen, that you outlined, you know, where it actually is in the system. But Lynn's question is, when you survive and finish the 5-year journey, which does drive me a bit mad as well, but that's another bandwagon I can get on for another day, but does that mean lymphedema won't rear its head? Louise, I'll throw to you on that one.
That's a good question, Lynn, and that's probably why so many of you have registered for this webcast tonight, because lymphedema is a big issue, because you can be finished all of your treatment, and as Jen said earlier, lymphedema can occur any time after you've had those lymph nodes removed. We know from the literature that probably the most common time that it may trigger is about 18 months to 2 years after surgery. But I have had women who have come to me 5 years or 10 years down the track and they've noticed symptoms with their arm. Now, probably what we know now is that those women were probably in this very early, what we call subclinical stage, where you don't actually see a volume difference in the arm. And their lymphatic system has stayed in balance like this, been for a long time, and then something has happened that the system has got out of balance. Whether that's been an infection or an increased load on the system, but whatever reason, it can happen in the future, but it's a very low risk. So, the common time is that 2 to 3 years that it may happen. But I guess if you're establishing good routines, good exercise patterns, and being in tune with your body, hopefully you can pick up any of those signs really quickly and seek out help.
Yeah. So, Marilyn, there's a question that's come through around wearing a sleeve. So how often do you wear your sleeve? When do you put it on? When don't you? I know you've got it on tonight.
Yes.
So what are some of the rules you kind of govern your sleeve usage by?
Basically, I put it on usually after breakfast, and I will keep it on for the majority of the day and take it off early evening. If I'm travelling, of course, I keep it on more long term. Fortunately, because we've got it hopefully under control, and it is a lot better than it used to be, there are days if I'm not doing anything exciting, I might be having a quiet day at home just to rest and just kick back and have a lazy day. I will leave it off. And I have consulted with Louise and she said that's fine. So, but I can tell when my arm needs it and I won't take any risks.
Yeah. What are those warning signs for you when you know you've got to look after it more?
I can feel it gets that sort of heaviness. It doesn't necessarily feel bigger. It just feels different. It feels a little bit heavy, and achy, I guess. But I've got used to wearing the sleeve. I know it's very off-putting to be told you need to wear one. It's not the most attractive thing, but then neither is a very swollen lymphedema arm. So I find most people don't even know I'm wearing it, even when I've got short sleeves on. And that goes for strangers as well as people that know me. And in fact, friends that know me say, I've forgotten that you wear it. Yeah. I stick with the basic beige, but you can these days get them in a lot of patterns, a lot of colours. So for those that want to be a little more bold, particularly our younger ladies, then, they're there. The options are there.
Oh, you can get tattooed sleeves now. It's like,
yes.
So it looks like you've got a sleeve tattoo. So you could be playing the AFL or the rugby with that sleeve on. But Louise, what's your recommendations around when you wear the sleeve, when you don't?
Okay, that's like opening up a can of worms.
Sorry. And it might be something that we cover more in the second webcast, because we are planning to do a second webcast and there are a lot of questions coming through on that. So,
I can make some comments.
Yeah, sure.
Compression therapy, so the sleeves like what Marilyn's wearing, is evidence-based in that it's one of the most effective treatments for controlling, reducing lymphedema. But psychologically, it's a really big factor for women, because you could be sitting in this room and no one need to know that we've had breast cancer. But as soon as you're in the room with a compression sleeve, then the question's asked. And it's almost that daily reminder that you've had breast cancer years down the track. So that also helps to support the model of early detection, because if you get it early, you don't have to necessarily wear the sleeve all day, every day for the rest of your life. But it's something that I would suggest if you've got lymphedema and you're wearing compression therapy, you need to talk to your own individual therapist to work out a plan for you so that you're feeling in control and that it meets your lifestyle demands. There's some people who can't wear a sleeve when they're working, say, as a nurse in a hospital, because of infection control, but they may wear it at other times to help give their lymphatic system that extra pump. So it is quite individual, but we do know that compression therapy is effective, but there's lots of styles, lots of brands and lots of options. If a simple compression sleeve is hard to get on, then there are other types of products as well that may help.
And I think it's important to note that BCNA on our website have, because all of the garment schemes are so different around the country, that we do have a resource there that will identify where you need to go to have access to some of the garment schemes in your state. And I promise you, South Australians, we are continuing to work with the Lymphedema Association in South Australia to really lobby to get an access program up there. Jen, a question that often comes up is around cording. Can you tell us, and often it's in that discussion around lymphedema, tell us a little bit about cording and then how the treatment and aspects of it is so different to lymphedema?
So cording can happen post-surgery, and basically what happens is that the tendons and whatnot sort of tighten, and when you're feeling underneath your arm, it feels like you've got a cord there. You can feel a ridge. Usually what happens if I have someone that mentions that to me, and it sort of does limit how you're moving your arm because it can be quite painful. And usually what I do is I do refer them back to the lymphedema specialists and the physios and the OT team. Fortunately, they're all the same people with our group for intensive massage. And that's basically how they get rid of it. They just have an intensive massage regimen. And then as things loosen up, people can move their arms back and, there you go, all fixed.
So as a breast care nurse, we know that so many of our members rely so heavily on you helping to navigate that system of support. What advice do you give someone who might not have Louise at the other end of the corridor? Like, what is some really practical things that people can do, particularly women in regional areas which might not have the access to the support services?
Well, I think even the simple things like massaging yourself and, as Marilyn said, you do need to sort of take some accountability and find someone. There are fortunately a lot of breast care nurses around Australia now, even in rural and remote areas. There's always the internet, there's BCNA, there's ways of reaching out to people. And I think, that's probably a good suggestion to start with. Just get on the internet. It's, you can find lots of resources on there, but just simple massage and, trying to avoid infection. I, get a bee in my bonnet about people having blood tests and say, oh, you can't have this, you can't have this. At the end of the day, you can be in the gardening, you can get scratched by a rose thorn and you're at risk of getting lymphedema. So my point is that there are things that happen that you actually can't prevent, so use your arm normally. That's what we say. So, but take some accountability, sort of look at what's out there and, if you're concerned, speak to someone, even a GP. There's someone out there who can point you in the right direction, even if it's in a bigger town, there's resources out there, you've just got to find them.
So, Marilyn, what advice would you give yourself if you had your time again? Because I think it's always so nice to hear from other women the things you wish you knew then what you know now.
That's an interesting question. I guess because I was so lucky that from day one I had advice. I had Louise and the rest of the team, my breast nurse, that they were all there for me. I guess some of the things I sort of think of now, we talked a lot about the need to moisturise and for cleanliness, and that was drummed into me very nicely, and I followed that. And I still managed to get cellulitis 3 times in 18 months. And on all those occasions, we never really found out why. I didn't have any gardening accidents, sketch. So I think one of the things I needed, it would have been, with hindsight, I sort of thought, well, I'm doing all the right things, therefore I'm not going to get cellulitis. And I did, out of the blue. And as Louise said, it's very important to get that diagnosed and get to a hospital or a doctor very quickly. I could not believe how quickly I went from feeling a little bit off colour, maybe I picked up a virus, 24 hours, and I suppose 3 hours later I was in hospital on a drip. That's how quick it was. And thankfully my breast nurse took my call at 9:30 at night when I started to realise what was happening and just said, in the car, go to emergency. So, yeah, with hindsight, I was a bit cocky maybe. I'm doing everything right, therefore that won't happen to me.
That's such great news. I'm conscious of time, and I think the cellulitis discussion I would really love to do in our second part of the webcast. There is a question that's come through that I think you'll be able to answer quickly, Jen or Louise, around is itching a sign? No, I thought you'd be able to answer that very quickly. We have come to the end of our session. I want to thank you all so much. We can actually talk about lymphedema forever. Well, we all can because we're very passionate about it. But we do plan to do our second webcast, and we want to make sure that we're really addressing all of the needs that you have. So if you are watching this live, then continue to put questions in. If you are watching this as a post-recording, then you still have time to put questions in for our second session on lymphedema. If you know someone else who's been affected by lymphedema or who worries about lymphedema, please send them the link to this website so that they can watch the webcast, which will be linked onto BCNA website as soon as possible. I want to thank you all very much, Marilyn, Louise and Jen, and please keep your questions coming through. Know that BCNA is always there for you. We are there every step of the way. You can call our helpline and speak to any nurses, and we will help you to navigate the system on 1800 500 258. And of course, we have the online community, and I know they are very active in the area of lymphedema and many other things. So thank you so much for coming. We are 1 minute over time, so that's okay, right? And I want to thank everyone who sent through their questions. Please keep them coming, and we're looking forward to bringing lymphedema number 2 to you very soon. Thanks a lot for joining us.